Hi, my name is Kenzie, and this is my head-to-toe assessment video. I'm going to come into my patient's room, I'm going to perform hand hygiene, and I'm going to close the door and close curtains and provide privacy. I'm going to ask my patient his name and date of birth. I'm going to verify that on his wristband and on my computer. I'm going to ask my patient if he has any allergies. I'm going to ask him if he has any pain, and what would your pain be on the scale of 1 to 10, 1 being very weak and 10 being very strong. If he has any pain, I'm going to assess that with character, onset, location, duration, radiation, relief, and severity of the pain. Okay, and then I'm going to obtain some vital signs. So for systolic, we want normal range would be around 95 to 165, and then diastolic 60 to 90. Temperature 97.7 to 98.8. Respirations 12 to 20 per minute. Pulse 60 to 100 beats per minute. And O2 stat, we want normal range to be between 90 to 100%. So then I'm going to go on and ask my patient, do you know what happened? Do you know where you are? Do you know what month it is? Can you tell me the president? Just making sure that they're oriented to time, place, and their situation. I'm going to assess how their mood, and my patient's mood is accommodating. They are responding to my questions, and they're alert. So they're calm and cooperative, I would say. Then I'm going to go on and assess my patient's head, feeling for any masses or lesions, making sure everything is symmetrical. And then I'm going to go down to their nose, make sure their nose is patent. I'm going to occlude a nostril, check that nostril, occlude this nostril. Ask them to breathe when I occlude their nostril, make sure everything's good. I'm going to assess their eyelids, the outside of their eyelids and the outer portions of their eyes, make sure everything looks symmetrical. I'm going to ask them to open their mouth, and I'm going to shine the light in. I'm going to ask them to say, ah. I'm checking make sure that their palate rises and that it's symmetrical. I'm also assessing their gums, their teeth, their tongue, just making sure everything looks intact. And when I ask them to say that is cranial nerve 9, which is glossopharyngeal. And if I ask them to say or like if I ask them to do a gag reflex, that would be cranial nerve 10, which is the vagus nerve. Alright, now I'm going to assess their eyes. So I'm going to take like this, and I'm looking for pupil dilation and constriction. Alright, now I'm going to ask them to keep their head very still. I'm going to go into their nose and out, making sure that the eyes are crossing and pupils are dilating. Okay, now I'm going to do the H. You can do the H or STAR method to tell them to keep their head very still and just to follow with their eyes. Okay, so for that, I'm assessing cranial nerves 3, 4, and 6, which is oculomotor, trochlear, and abducens. And I'm also assessing PERLO, which is pupils are equal, round, reactant to light, and accommodative, which they were. Okay, now I'm going to assess the neck. I'm going to make sure my patient is up at a 45-degree angle. I'm going to palpate on each side one at a time, this on their carotid artery, and I'm looking for any jugular vein distension, like any pulsating, anything that is visible to me that I could see that would be abnormal. Now I'm going to auscultate using the bell of my stethoscope on each side of the neck, which should be here and here. I was listening to see for the rate and rhythm, seeing if there was any, or if there's any swishing or breeze, which would be abnormal. Okay, now I'm going to ask my patient if they could shrug their shoulders and then turn resistance of their neck like this. This is cranial nerve 11, which is the accessory nerve. Testing their strength. Okay. Now I'm going to go down their arms, and I'm going to check their radial pulse, both at the same time right here, thumb side. I'm going to check those at the same time. I'm assessing the rate, which would be 60 to 100 beats per minute, making sure that the rhythm is appropriate and normal, and checking for symmetry, and that the amplitude is a 2+. Okay, now I'm going to assess for cap refill, so I'm going to go to each finger and give them a little squeeze, and make sure that they refill within 2 seconds. Now I'm going to ask my patient to close their eyes, and I'm going to touch them and check their sensation if they can tell me where I'm touching them. Alright, I'm going to ask my patient, do they wear any contacts or glasses, if they have any blurry vision, if they have any, if they have hard of hearing, if they can't hear, or if they wear hearing aids, document that. Okay. So I'm moving on down to the chest and abdomen. So I'm looking to make sure that the AP diameter ratio is 2:1, which means that the chest is twice as wide as the depth, which everything looks normal. Now I'm going to listen to the lungs. I'm assessing for clear lung sounds, making sure everything is clear, assessing the rate and rhythm, rate and like the depth. I'm going to do respirations, which should be 12 to 20 respirations per minute, making sure that the depth is not too shallow, everything like that. So I'm going to listen to the right upper lobe with the diaphragm of my stethoscope, the left upper lobe, tell my patient take a deep breath with each movement, then the left lower lobe, right lower lobe, and I'm going to listen to the sides. Okay, then I'm going to move to the back. I'm going to do the right upper lobe, left upper lobe, left lower lobe, and right lower lobe. Alright, everything sounds good. I don't hear any wheezing, crackles, or rhonchi, anything like that. I hear everything is clear. Alright, now I'm going to move on down to the abdomen. Oh no, now I'm going to listen to the heart. So I'm going to listen to the maximum impulse, which is the mitral, which is right here. I'm going to palpate and inspect and listen to that for a full minute. Well, not for a full minute. I'm going to just make sure assessing the rate and rhythm and amplitude of that. Okay. Now I'm going to go to the heart, and I'm going to also take the heart. So I'm going to go to the second intercostal space on the right side, which is the aortic place. S2 is louder than S1 here. This is the second intercostal space on the right side. And then I'm going to go to the second intercostal space on the left side. This is the pulmonic area, and S2 is louder than S1 here. And then I'm going to go to the third intercostal space on the right side, on the left side, and this is Erb's point. S1 and S2 should be equal here. And then I'm going to go to the tricuspid, which is in the fourth intercostal space on the left side. S1 should be louder than S2 here. And then I'm going to go to the fifth intercostal space, midclavicular line here, and this is the mitral area. I'm going to listen there. Heart sounds good. I'm assessing for the rate and rhythm, and everything sounds good, and amplitude, make sure everything's good. Right. Now I'm going to go down to the abdomen, and I'm going to also take the abdomen first. So I'm going to do the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. I'm listening for bowel sounds, 5 to 30 bowel sounds per minute. That's normal. And if I don't hear anything, I'm going to listen for 2 to 5 full minutes to see if I can hear anything. I'm going to ask my patient, could you tell me when your last bowel movement was? Can you tell me the last time you peed? Do you have any urinary incontinence or retention? I'm going to check their femoral pulse, which is in here. So now I'm going to move down to the lower extremities, and test the range of motion in both. So I'm going to ask my patient if they can lift their arms out like this, and if they can bend their elbows, roll their wrists. Okay, and now I'm going to ask them if they could roll their ankles, and if they could stand up and bend their legs like this, and then go to the side like this, and go back. Just anything to make sure I assess that their ankles, knee, and hip, they have range of motion in them. Now I'm going to assess for capillary flow on the feet, on the toes, both sides. I'm going to assess their pedal pulse, and I'll listen for listening for the rate and rhythm and symmetry of those also. And now I'm going to do their posterior tibial pulse, which is in the inside of the ankle, listening for rate and rhythm and symmetry there, and amplitude 2+, that's what we want. Okay, now I'm going to ask them to close their eyes. And can you tell me where I'm touching you? They can tell me. Okay. Throughout my assessment, I assess the skin for color, temperature, if any edema, moisture. I checked for any lesions, ulcers. I checked for the IV sites if they had one, and if there was any invasive lines, which they do not have, but I would assess those if they were. Now I'm going to document my findings and determine a Braden scale. Anything below 18 is a risk for ulcers, for pressure ulcers. So I want to make sure I rotate my patient if it was below 18 and the max score is 23. And I would wash my hands before I leave and thank my patient for